morning, everyone. You're listening to Caregiver Crossing, a podcast brought to you by Joy's House. We are so blessed and thrilled that you're here. Caregiver Crossing, if you don't know, is a podcast. You do know, we're a podcast that's created just for you, the caregiver. I am Tina McIntosh.
And I am her friend, Terry, and we're here every week. We've got experts from across the country providing comfort and resources to our caregivers. And this podcast really serves to embrace family caregivers of today and tomorrow. So thank you for all being here today. And Tina, take it away.
All right, I'm going to say something. You're going to be like, I know this. I can just look around. But the population of the United States is aging. There are today more than 46 million older adults over the age of 65 in the United States. And by 2050, that number is expected to grow to almost 90 million, Terry. So between 2020 and 2030 alone, the time the last of the baby boom cohorts reach age 65, the number of older adults is projected to increase to almost 18 million. As the number of seniors in our community increases, so does the need for reliable direct care support. That certified nursing assistants and other health care aides provide. So now more than ever, we need quality training programs to both attract and equip the next generation of professional caregivers. I mean, what that really means in short is we don't have enough people to take care of aging adults. So joining us today, we have an expert. Her name is Sue McPherren. She's the program director from Senior One Care's Legacy CNA Training School. This school is doing great work. They've been doing it for years. They have a lot more work to do. We're going to talk about that. They're providing high quality, accessible, and affordable training to prepare the direct care professionals that we so urgently need in our communities. So we're going to jump right into this. Sue, welcome to Caregiver Crossing.
Well, thank you very much for having me. I appreciate it.
Carrie, do you know much about CNAs?
Not too much about CNAs, but when I heard those numbers that you were talking about, I thought we better have enough of them because we're not ready. And we've been talking about this for a couple of years. And we keep saying, we better be ready. We better be ready for this number that we're looking at. But, Sue, tell us about the work that CNAs do and who they serve.
Sure. Actually, certified nursing assistants basically do what's called activities of daily living. So for individuals that we take for granted, we take getting ready in the morning and that kind of stuff is just normal behavior. Some people just need assistance with that now. And so the Indiana State Department of Health came up with 72 procedures that a student has to get certified in. And that's how they get their CNA license. So they care for the aging population, and they help with simple things like transferring someone, helping with them brush their teeth, eating, just basic things that you and I take for granted.
And so these, the folks that get their CNA training, they don't have to be, this doesn't have to be a 30-year-old woman doing this. They can be what age to be trained?
16 years and older, and we have trained as young as 16 all the way up to people in their 70s. So people are going through lifestyle changes right now. Maybe they've always wanted to be in healthcare but went down a different path. We've noticed a lot of people since COVID come to us because they're feeling a need to help people. So we see all different types of ages come through.
And where do CNAs work?
Right, they can work in a home, apartment, assisted living facility, long-term care facility, in a nursing home, hospitals, really, rehab units. There is a list of places they could work.
So pretty much anywhere people live.
And you mentioned this great resignation that just happened and that we're going through right now, where people are trying to figure out a new path for their future and their career. And so this sounds like something that any age, or what qualifications would you need to become or to enter a CNA program?
You just need to be 16 years of age. We do a criminal background check that's required. TB test or chest x-ray and a physical examination is just the basic that we need to get a student enrolled in the program.
As young as 16.
Mm-hmm. Mm-hmm.
So let's talk a little bit about how long does the training take for someone to go through?
Well, prior to COVID, it was slightly different. Since COVID, Governor Holcomb changed the regulations. So prior to COVID, it was a minimum of 105 hours, which translated into about 5 classroom days and about 10 clinical days, or lab days. Now, Governor Holcomb, since the pandemic, lowered the requirements to 75 hours. So
Wow.
yeah. So, and that's a blanket waiver right now that's going on. And that blanket waiver, from what I understand, is extended through the end of June. And then they're giving us 45 days after that to transition back into the old curriculum. But Legacy CNA Training has done a fantastic job of getting these people, getting their credentials out there, getting these people out there to help the community. And we're getting it done in 9 days, 4 days the first week, 5 days the second week.
We know that there's a nursing shortage, and we've been hearing that this nursing shortage isn't anything new, that this has been coming. This is it. Talk a little bit about the nursing shortage and if that does affect what a CNA does.
Oh, well, yeah, it definitely. They can only do 72 things though, but they're utilizing, we have a number of different things. So we teach CNA classes and QMA classes. CNAs do more hands-on care. QMA classes are qualified medication aid classes, and they are stepping in and passing the medications for the nurses. So, the need is definitely great. And with, these baby boomers and with the growing in population and with everybody wanting to live in their homes longer, I personally feel that caregivers are fantastic, but caregivers that have a CNA credential is essential as far as I'm concerned, because most of these caregivers that are out in this community caring for people, they're on their own. So having that knowledge of that CNA credential linked with being a caregiver, to me, is essential.
When I think about these certified nursing assistants, it's really the basic of the knowledge you need for any care. I mean,
right.
You're teaching these 72 procedures. You're giving the foundation of knowledge through your training at Senior One Care's Legacy CNA Training School. What does it cost? I guess that was a question we haven't asked. What is the affordability?
Okay, so it's $2,200.
Okay.
And prior to this upcoming year, so January 1, 2022, it was all funded through Next Level Jobs for the past 2 years. It was 100% paid for as long as you lived in Indiana and you graduated from high school. So that stopped as of January 1. We're hoping that does come back again because the need is so great. I get calls all the time from facilities, nursing homes, hospice, people just really needing help. And so right now they're coming to us either with grant money from Work One, or like an employer is sending them, but that's how it's generally getting paid for right now. Students don't have the funds right now to pay for it on their own. Just think of what's happening with inflation and everything like that.
So how are people paying for it?
They're going through Work One. Okay. Work One has some grant money. They're expecting more grant money. Employers are paying for them to go through the program. And then those are the really only ways right now, or private pay. And we don't have too many private pay people because people need the tuition assistance. So we try our best to help them.
I'm just thinking if, for listeners, if they're thinking, hey, I want to go through CNA training, or if someone who's listening knows of someone who really should be going through this training, or they're an employer and they want someone to go through it, to be having that conversation or to at least be connecting with Work One would be important. Or I would suggest that you contact Senior One Care at their Legacy CNA training. And something tells me that Sue McPherren here as the program director and her team will try and connect you and try and, help you find a way to get into that program as well. So these 72 procedures, I love that you're working with students who are 16 and beyond. One of the things that we talk a lot in our household, we've got kids who are, middle school, high school, and college age. And we talk with them a lot about, Sue, is this push for college. And of course, there's great value in college, but my goodness, we push kids into college and forget about trade work, and we forget about care work all the time.
Exactly. I started out as a nursing assistant myself prior to going into the medical profession, because honestly, I wanted to figure out whether this was the field that I wanted to go into. I wanted to get a little bit of a taste of it. And now it's so important for people that are going into the medical profession. It's a great foundation. And most colleges are requiring a CNA credential even before you start nursing school. So I feel it's seamless. I really do. I think it's very necessary for somebody to just get out there and work and experience it. And I found it a wonderful transition into the medical profession. It made it a lot easier for me.
Absolutely. Well, we absolutely love what you're doing. There are other CNA training programs. We don't want to, act as if you're the only one out there, but how do you compare to the others that are out there?
Well, I think if you would get to know my instructors and myself, we're so passionate about teaching. We really care about the students. We get to know the students because, let's all get this right out and open. Everybody has their strength and everybody has their weaknesses. So we get to know these kids in the classroom and these young adults and adults in the classroom. We get to know them in their clinical space when they're actually working with residents and training. And then more importantly, what we do that other schools really don't do is once the training is done, we meet with them individually and we go over questions with them. We help them relearn about the body. I mean, they're learning about lots of different things in the class. You're learning about the body and the systems within the body and how diseases affect. That's a lot of information right there. So we do one-on-one tutoring, not only with the skills, but help them relearn about the body again. Because when you get it all done in 4 days, that's a lot.
I just want to ask quickly. And then after they get their certification, is there help out there for them for job placement?
Oh, yes, but they don't have a problem finding a job. If you just, the jobs are everywhere. They really are. They really are. Just get on Indeed and look up certified nursing assistant training and it'll all come up. So,
and if they want to go to a new state, they would need certification in a new state, correct?
Right. So what they would need to do, if they would get certified in the state of Indiana, once they get their credentials in the mail, then they would, like, let's say they wanted to move to Michigan. They would call the Michigan State Department of Health, get in touch with their CNA department and apply for what's called reciprocity or just a license transfer. Pretty easy normally, might just be a small fee or a small test, but usually they are interchangeable state per state.
That's terrific. Sue McPherren, the program director for Senior Care's Legacy CNA training. How do they get a hold of you, Sue?
Hey, all they need to do is we have 4 locations, Carmel. We have one now in Fort Wayne, Mishawaka, and then in Elkhart. Call Senior One Care. They can transfer it to us or just call us directly.
Excellent. Tina?
Sue, we're so grateful you're here. As we close the show, we want to remind our listeners that they can contact me for more information and resources to help through the journey of caregiving at tina@joyshouse.org. And of course, Caregiver Crossing is supported by our friends at AARP. They are leading a revolution in the way people view and live life after the age of 50. We love that they're working to empower people to choose how they live life as they age. And so until next time, take good care of each other, and we will see you next time here on Caregiver Crossing.